do 7 tests. Is that right? 7? 1, 2, 3, 4, 5, 6, 7. We're going to do 7 tests with the tape measure. The tape measure is our, we're biased, it's our preferred method of measurement just because it's more reproducible. A couple things about range of motion of the spine. Okay? When you go to do a skill check or you go to do a lab practical exam, we do not expect you to do passive range of motion for someone's spine. That would involve having them lie down and trying to mobilize their entire upper or lower body to see what their passive available range of motion is. And that would not be good for you or the patient. So, passive range of motion is not a factor. Just want to make sure I make that very clear. I also want to make it very clear that the other thing that's unique about the spine, whether it be tape measure, goniometry, or inclinometer, there's a much higher variability of normal range of motion limits. Very, very highly variable. So here we're looking at, again, it's very patient specific. What is this tape? What's normal for this patient? What do they have? What can we gain? Certainly we try to work towards the norms, but again, there is a much different. There's different levels of variability among what is accepted as normal and what we shoot for as normal. So that's a little bit more unique. And then there are some different methods that we use. We like to tape measure. If we have the choice to measure in inches or centimeters, what are we going to choose in the clinic? Centimeters. It's a little bit more small. It's a little smaller. It's a little more accurate as a result. So that's not going to go away no matter what area of instruction you're receiving. So we use centimeters. We're going to show you some different methods for flexion and lateral flexion. And then I'll show you the test for extension and rotation as well. We're not going to go over the goniometry and the inclinometer. Well, do you want to demonstrate the inclinometer? Very quickly. So the thing that's hard about the goniometer is the axis has to kind of move, and
there's math involved. There's holding two things.
So we like to tape measure. The tape measure is pretty easy to reproduce, and the landmarks are pretty standardized. So that's what we're going to go over today. So you want to do them all at once and then have everyone practice, or you want to do half of them, practice, take a break, and then do
them all.
Okay.
They're very similar.
I need a model, please. I need someone to be my reference here. Anyone want to be reference? Sure, come on over. Okay. And again, you know, it's going to vary depending on your population. For me, I like consistency, and if I had a PTA, I would make this clear to them that I would want to test without shoes if it was safe for the person, but I don't want to confuse you because I know for the last 2 terms you've been told that everything should be done with non-stick footwear. So, but I just want you to know that I've had patients who come in wearing 6-inch heels. I've had patients who come in wearing flip-flops, and because it varies, especially among female patients, the very height of their soles, I like to do this for consistency. No shoes. Test with no shoes. So, anything else? I think that's good. We're going to do centimeters. I'm going to show you 3 methods for assessing flexion. Okay, and generally, it's really difficult to isolate lumbar versus thoracic here. So we're basically looking at thoracolumbar. And as we talked about earlier, because of the orientation of the facets of the lumbar spine, more in the sagittal plane, most of the motion is going to be coming from the lumbar spine. Okay. Just want to mention that, but we're basically looking at combined thoracolumbar flexion. So for the first test, I'm going to have Melissa show me actively, and I'm going to kind of visually assess what I think she can do. Now, Melissa, what I want you to do, I want you to keep your feet about shoulder width apart, okay? And I want you to try to keep your knees relatively straight. I don't need you to hyperextend on this side, but I want you to keep your knees straight, okay? What we're going to have you do, when I say go, I'm going to have you kind of gently hinge forward through your hips and your lower back.